Thank you very much for everyone for joining the webinar, Travel Restart, Policy versus Reality. And our host, Damien Cook, will begin with the introductions. Damien, please.
Thank you, everybody, and welcome for those guests joining us from around the world. We've got fantastic attendees, over 200 people who are with us today for today's webinar discussion of Travel Restart, Policy versus Reality. Thanks for that introduction, Graham, and thanks to Pata for setting up this event today. My name is Damien Cook. I'm the CEO and founder of eTourism Frontiers. I also worked with Pata and a team of developers on the Crisis Response Center, the Pata CRC, which is now live online. We're providing more details and referring to that a couple of times today as a resource for destinations and industry members who are looking for support during the COVID crisis. We've all been through this crisis together. We've also, around the world, been through many of these webinars together. We've all started to see a little bit of fatigue with discussions of COVID as an unprecedented crisis and discussions of crisis management. We're now moving well beyond that initial period of reacting and responding to this crisis into what we hope to be the resumption of travel. And that's the topic of today's, what is happening around the world? What is the reality on the ground as opposed to what we're hearing at a policy level from international bodies and from governments when it comes to the practicalities of actually restarting travel? We've got a fantastic panel of speakers today that I chose based on people who are on the ground in destinations and in tourism businesses, and in those tourism businesses that have been the most impacted, and also, it's my belief, represent the future of the way that travel is headed. Joining me is my colleague, Greg Claassen, who you may have heard speak before with me. Greg and I have worked together with multiple destinations as destination strategists and consultants, developing strategies for tourism, particularly during this time. Greg is the former CEO of Canada Tourism and CMO of Canada Tourism and brings a lot of destination insight. And we'll be taking a look at the global picture today of where we stand for the resumption of travel. Looking at it from a destination perspective, but from a slightly different destination perspective, I'm very pleased to have with us Dorji Dradhul, who's the Director General of the Tourism Council of Bhutan, a destination that's always done things differently when it comes to managing their destination, particularly the protection of cultural and natural resources, and also a destination that's taken a different approach when it comes to volumes and yield of travel, something that will play a key role as we start to move forward. And Dorji will be speaking on that topic with us today. On the private sector level, we're also pleased to have with us two of my good friends, Muna Haddad from Jordan. She's the CEO and founder of Baraka Consulting, but also manages accommodation and experiences in Jordan as well, at a very local and community-driven level, and has seen the impact of this crisis on that form of tourism, and is watching keenly to see how it develops into the future. We also have Raj Gwali, last but not least, from Social Tours in Nepal, an adventure and community cultural travel expert and founder of Social Tours. He also works with local communities and small tourism products in Nepal, and will again be talking about what he sees as the future of managing and developing the restart of travel. Before we get into this with everybody, I want to set the agenda for us today. We're going to be talking about this travel restart that everyone is talking about. Travel is restarting, we're hearing from all corners, but is it really? What is the situation on the ground? Greg will be looking at that, and then also with joining George into the conversation to talk about challenges for destinations moving forward. Then Muna and Raj will be coming in to talk about challenges for accommodation, for niche and experiential travel, and we'll all look at solutions in terms of where we're headed. If anyone has questions today they'd like to ask, there's a Q&A tool there on your webinar platform. Feel free to type those in. Graham will be moderating and sharing those questions for us so we can try and fit some in at the end. We're going to try and keep this down to 45 minutes if possible. We know people are busy. We know everyone has that webinar fatigue. We're going to try and keep it as dynamic and discussion driven as we can. But let's start with some of the position of where we're at. We're now very much entering what people talked about through all those previous webinars as the new normal. And we heard a lot of discussions when COVID first hit about how the pandemic would change travel. And there was global recognition that we're seeing a major existential change to the way that tourism works around the world. Lots of negative discussions. The positive spin that we heard put on this was that maybe the end result of this would be a new, smaller, smarter, and more sustainable sector. But what's happening? Are we seeing that new positive form of tourism starting to take over? And is travel starting to rebuild in a new way? In many ways, we're starting to see a bit of the return of a new old normal. Borders and air routes are starting to open around the world. We're seeing a lot of pent-up domestic demand driving some initial domestic travel, along with the return of essential business and VFR, visiting friends and relatives, as borders open. A lot of the government stimulus and support for the industry has been centered on the aviation industry, obviously, but also on large-scale tourism businesses such as cruises and hotel chains. So many countries are starting to open up and they're starting to declare themselves safe for travel. And this is where we start to see some interesting issues emerge. 29 countries around the world have declared themselves as officially safe for travel. In almost all cases, this means the self-regulated implementation of protocols for managing travel, the majority of those in recognition from global organizations. According to WTTC's stamp, there's 29 of these countries that have received a travel safe stamp, those countries around the world. But how was this attained? Was there inspections? Was there a protocol for doing this? Or was it just agreeing to some internationally published standards and protocols? There's a lot of confusion around this, particularly when you consider that all of those 29 countries by US CDC standards are still categorized as Category 3 infectious and high-risk travel destinations. The handful of destinations that have been declared as safe for travel by those CDC standards, Thailand being one of them, are not in this list. So there's confusion about how exactly we are defining safe for travel. So is this working? We're seeing that domestic travel, we're seeing that initial business and VFR travel, but long haul travel is clearly a challenge. And it seems that the more complex the travel process, the greater the reduction in demand. IATA just this week published a survey from July that showed a 16% decline in the willingness to travel among potential passengers from April at the height of the pandemic. 16% less people are saying that they're willing to travel. That's because of second waves that we're seeing everywhere, but possibly other issues as well. As countries do open their borders and air routes resume, we're starting to see many of those already reduce as they see a lack in demand for those seats. You may have seen today that Air India have taken out 9 of their European routes. Here where I'm based in East Africa, Kenya Airways is reducing a lot of their regional routes as well because the demand just isn't there. Those OTAs that were driving travel of Booking.com, as you may have seen, have laid off more than 4,000 staff. Other OTAs reporting business down by 70 to 85%. So what's wrong here? What is stopping this restart of travel as destinations start to open their borders? What is the block to people traveling? A lot of it is the messaging and the perception of what travel is now like, both the reality and the image, but also the reality has become fairly daunting. When we see stories like this that are driven by these protocols, Singapore saying that travelers to the country will now have to wear electronic tags while they're in the country so that they can be tracked to enforce quarantine. These are the complexities that are starting to make travel a fairly unattractive activity. This story, which is real, Emirates publicized that if you do contract COVID when you're on one of their flights, they'll cover the costs of your funeral. Seeing this almost as an incentive to travel, to me, a fairly large disincentive to travel, to be told that don't worry, please fly with us, and if you die, we'll cover the costs. So messaging and perception of what travel will be like is starting to influence people's travel decisions. And unfortunately, we seem to have lost sight of the core experiences that travel involve, those appealing experiences, and become overly focused on the protocols, and the process of travel has become the message. Let me give you one example. And I've chosen this from just one of those 29 countries that's declared themselves as safe. I haven't singled out a destination here, but this is Egypt, who are driving themselves as a reopened destination. This is how they are publicizing Egypt as an open and safe destination to visit. get the idea. Almost every 10 seconds, an image reinforces sanitization, hygiene, masks, spraying, cleaning of hotel rooms and any public facilities. Is this really a marketing message, or is this just creating fear and reinforcing the process over the experience? We really need to ask ourselves if we're forfeiting our role as marketing our destinations to the management of our destinations at a health and safety level. Now, some people think that ad is great. Some people think this approach is going to work. But ask yourself, what if this was a terror threat we were facing? What if this was a security threat we were facing? Would any of us publicize a destination like this? Of course we wouldn't, but what is the difference? People will want hygiene and health as an assumption, as a single simple message that you've met standards and protocols that are locally appropriate and enforced. But they do not need that pushed into their face as a marketing message. And this may account for some of the unwillingness that we're starting to see in travel. One of the challenges is that these protocols are being delivered at a global level into global standards. And these are then supposed to be interpreted into local businesses. These protocols are about management processes of high volumes of travel and tourism, which are often impractical for smaller destinations, regions, and small businesses to bring into function. We're finding that locally developed or sector-specific protocols, such as those for the adventure industry or other sectors, are more effective. Problem is these protocols are driven by scale, and scale has always been a buzzword in tourism. And those of us that work in tourism strategy know that we've talked about yield, financial yield of tourism in those terms of scale for many years. This model used by the World Bank for tourism yield, that in order to generate $10,000 for a destination, it takes 4 fully independent travelers, 9 package tourists, or 96 cruise passengers, has been a way of showing us why sometimes focusing on that smaller scale and high yield tourism is more effective. When we take that same model and apply it to these protocols, it's obviously much easier to create social distancing and open experiences for independent travelers or even a managed tour group than it ever would be for trying to create social distancing and protocols for a huge volume of travelers. And therein lies another one of these challenges. We need to start developing strategies based around scale. We're seeing that small businesses are the first ones to start reopening. In the destination where I live in Kenya, I've seen 140 room hotels unable to open because they've only received 20 bookings for the next few months, whereas small scale 10 room hotels are fully booked for the rest of the year. So scale has become an important factor. Smaller volume can be managed. The restart is most likely to happen with these small operators and be small and high yield. And we're in this unique situation where the smaller the business, the more sustainable they are, and the more likely to survive this are and form the new form of tourism. But how can destinations address this and build strategies based on scale? We really need to not lose sight of experience as being what will bring travel back, particularly in our marketing approach. We need to focus on experiences rather than processes. I've spent the last 2 months here in Kenya, where I'm based, working with the Tourist Board to share a non-stop 2-month solid stream of experiential content with the world via social media. And none of it involved protocols, masks, or health standards. All of it was about showing people experiences. But strategically within this, we chose those experiences where people were naturally socially distanced, in the fresh air, and having experiences that were safe when it comes to the protocols, without having to enforce and ram those protocols in front of people. Much more compelling and much more appealing for the potential traveler. So this really forms the agenda of what we'll be discussing today. Those are my contacts. Those are the links for the CRC, the new Crisis Resource Center that we've set up through PATA, where many of these issues are being discussed, and we're aggregating together both tools and recommendations for how destinations and businesses do restart and reopen. So to pick up on this topic at a destination level and talk about what we're seeing around the world, I'm going to hand over to Greg now to talk about his opinions and what he's seeing when it comes to the restart of travel. So Greg, over to you.
Great, thanks very much, and good morning, everybody. From East Coast of Canada this morning. It's very early here, but I know it's afternoon or late morning for many of you. So when Damien asked me to present today, we talked a little bit about what the difference is between what reality was hitting the road and what government policy, or in some cases it's just simple wishful thinking. And asked me what my views were as I've been working with destinations from both across Canada as well as other places around the world in terms of what that restart was. And my thesis here is this idea of trust and confidence for tourism. And until we rebuild that trust and until we rebuild that confidence, very similar to what Damien was referring to, we're never going to be able to rebuild confidence. And we'll go to the next slide, Damien, please. Damien, do I have? Okay.
I've got it.
So in terms of what I'm calling tourism in the age of COVID-19, the thesis here is that tourism will not recover until government and health authorities unscare our visitors. They've done a very, very good job of scaring us into staying home, into staying socially distanced, into using our masks, and into being very, very careful during these past 6 months of COVID. But as governments themselves want to try to reopen their economies, and as governments, especially in those destinations that are heavily tourism dependent and national and international tourism dependent, they're failing to unscare our visitors, and they're failing to unscare our residents into welcoming tourism and making people feel confident again. And we know that the governments right now are responding by pouring millions and millions of dollars of investments into their advertising agencies, into creating glossy recovery campaigns, much like the one that we saw with Egypt. And while marketing is our destination's most common tool, it's the tool that we best understand within our industry and our business, we believe that marketing itself cannot recover this tourism industry. And really, I think it's important for us to truly understand that first, understand where that problem lies in terms of confidence and fear that currently pervades the tourism industry. Until we can address that problem, we can't address all of those other tools that we have to go forward. Next slide, please. So we've got, sorry, where are you? When it comes to barriers to travel, we have those very traditional barriers to travel in the COVID world. We know that many of our international borders are closed. We know that even some of our domestic borders are closed. Intra-provincial, intra-state borders are closed in some particular areas. So these are real barriers to travel. But we also have the biggest challenge, which is our perceived barriers to travel. We have a very ambiguous messaging, amplification of those negative messages from very wide number of sources. First and foremost, our governments are obsessed and focused with messages of safety, but also of control, and controlling the virus, or controlling the impact of that virus that has on its population. And frankly, we're very happy that they're able to do that. But in doing so, they've negated the opportunity to help us come out again, help us feel safe, help open up our economies. When they do have messages about opening up restaurants and public areas, they scold us when we do it wrong. Or worse, there's hysterical media coverage that talks about outbreaks. And in some cases, these outbreaks have been 1 or 2 cases that have been found in large groups of people. And even more hysterical social media amplification of those messages. And we know that in North America, at least 35% of people in North America are getting their COVID-based information from social media itself. So we see an ever amplification either from the media or through social media platforms that create that sense of hysteria around travel and tourism. And we know that it results in sensationalizing these COVID cases. We know that there's a loss of evidence and data Data and evidence which started off us all down this journey, flattening those curves, controlling the virus, making sure that we didn't overwhelm our healthcare systems were very important, but we have lost that plot. Right now, evidence and data are no longer the reasons why some destinations are closed. We just had examples, for instance, of New Zealand after 100 days of no cases, now has somewhere around 4 new cases in New Zealand and a very swift closure over the next couple of days of that country, just a complete lockdown of that country. Is that an evidence-based solution, or is that a game of zero cases, and a political decision that supported that decision? We know that there are highlights of outbreaks of 1 or 2 cases. We talk about mask wearing or not. That's become very politicized, not just in the United States, but in other parts of the world. And again, as I said, sensationalized examples of resurgences in other countries. All of our news broadcasts are focused on the fear of this virus, making people stay in their homes and make them afraid. And I'll show you some evidence that supports just how few travelers out there, or few people out there are actually considering travel for the future. Inconsistency of messages from various governments. Yes, our economy's open. Yes, you can come out now, but do it too carefully and scolding us again when we're doing it wrong. And then, of course, ultimately instilling irrational in many instances, but in some cases, there's a rational fear of getting the disease, and importantly, there's a worry about giving the disease and they travel. Next slide, please. So this almost creates a complete erosion in the confidence of travel and travelers. The first one is a real fear of travel, in that tourism itself is the driver of disease. And I say those, and the second one is the fear of travelers themselves, residents who fear visitors coming into their communities and bringing their disease. And I call it those they perceive carrying a suitcase are also carriers of the disease. And again, these are irrational behaviors about travel and tourism. And until these irrational behaviors change, we will not be able to restart the tourism economy itself. Closing the economy was one thing. It was a fear-based message that came out from government, and it was necessary. But opening the economy is not a light switch. We have to unscare our potential travelers. We have to unscare our prospective residents to welcome those visitors in order to re-communicate that it's safe to come out again. The communication challenge of closing the economy was very clear, but reopening has been very much less clear and is having a significant impact on tourism itself. And until these emotional barriers to travelers have been addressed, tourism itself just simply won't recover. And even with a vaccine by itself will not necessarily address those barriers to travel, because again, as we've seen in media and of course in social media, that vaccines themselves have become politicized, and creating a lack of confidence in their effectiveness, or whether people will actually get them and take them. And these are acute challenges that are going on if we want to recover tourism and if we're all waiting for that vaccine to support the recovery of tourism. Next slide, please. So why is this happening? Well, effectively, it's happening because we're emotional beings. The emotional brain holds about 95% of the decisions that we're actually taking. And the single biggest and greatest emotion is that emotion of fear. And once fear is installed inside of our brains, we have very little control over that ration to create some rational ideas about what fear means. So fear means that if we've been instilled with that message that that coming out of our houses, that either giving or getting the disease itself is significant, even if it is tiny and minute, especially while traveling, the rational brain has very little opportunity to kick in. So the emotional brain is really that messaging that's being controlled right now by governments in order to keep us all safe. Again, done a very good job of that, but we need governments themselves to tell us that it's safe to come out using evidence-based decisions about the risk and the relatively low levels of risk to get COVID or to give COVID while traveling. Just given all of the measures that we're taking by wearing masks, by staying socially distanced, and being very, very careful as a result. Next slide, please. We also know that there has been risk indexes about which activities you can do and which activities you shouldn't do, the levels of risk. Again, governments mean well when they hand these out, and they're really meant to keep us safe, but there's nothing about these slides that make us feel safe about travel. As you can see, all travel-based activities on the right-hand side are given this big, very high risk, very mean red saying stop, stop, stop. Do not go forward. Be very, very careful with all of these things. Again, these are significant barriers in giving us confidence that we can either drive and stay in a hotel room or get on an airplane and go somewhere, in spite of the fact that some of those risk levels truly are not nearly as significant as they might be. Next slide. And even my own country of Canada recognizes that we have a confidence challenge, even though governments right now are spending in tens of millions of dollars on marketing campaigns to travel safely within Canada this summer. The key message of this video and the key message of this resource is know your comfort level and reduce your risks. They're literally telling you, our National Tourism Organization, the one that I used to be the CEO of, is literally telling us to pack all your food into your car if you're going to travel. Do not interact with locals. Do not buy from local grocery stores. Just be alone and be together and be socially distant from everybody else, but have a good time at the same time. And that's a significant challenge because, again, while attempting to try to make us feel more comfortable and more safe about travel, they're actually just reminding us how very unsafe they think that travel might actually be. And again, these are consistent messages from government across the board. Next slide. But governments have been rewarded for these messages. I've just picked a handful of my own country of Canada, but we've also got Scott Morrison from Australia. We've got Jacinda Ardern from New Zealand. In almost every one of those three cases, they have been given record approval ratings. In some cases, somewhere between 65 and 80% approval ratings for their governments. So staying the course is very important for them. And again, as I say, that in some cases, politicization of the COVID messages and keeping us safe have their constituents and their voters have rewarded them with very, very, very high approval ratings. In my own country of Canada, with almost every province, we have literally go from about 70 to 91% approval rating of government. This is where governments typically sit somewhere between the 30 and 60% range, are now getting into the 60 to 90% approval ratings. So why would they make any changes? Why will they open up the economy again when they're being given such rewards for keeping the economy closed and not allowing and opening borders and not allowing and opening travel within each of those countries? And by the way, most of these countries that are getting such high approval ratings are doing exceptional jobs themselves in reducing the spread of COVID within those countries. Next slide. So what are the tools that other governments are using to support tourism confidence? The first one, again, is COVID testing. We have tests availability. Iceland, for instance, is testing at airports. Testing at airports is recommended by the WTTC. If we were given COVID-free certificates as we were entering countries, perhaps we would become more confident ourselves in our tour and travel, but also be perceived by residents that we would be safer. Hawaii is going to start asking for proof of COVID-V tests within 72 hours of arrival. This will start in September, so they say. We also know that there's intra-regional borders. There is an ambiguous provincial barriers to travel here within Canada. Some borders are saying they're open. Some of them are saying they're creating bubbles. There's no evidence to support why some bubbles are happening and why others are not. It seems to be dictated by more geography or by more political questions than actual based evidence. Governments and health authority messaging, we need unambiguous opening up the economy using messaging platforms that unscare travelers. It is safe to come out. It is safe to travel. Here are your risk factors and your risk levels. They are very, very low in order for you to appreciate the travel experience. Encourage a safe return to travel. enthusiastically support tourism by governments and health authorities, not just throw $20 million into a marketing campaign and hope for the best, because that marketing campaign is running up against brick walls of fear of travel, and only governments themselves and the tools that they use through media and social media to help us feel safe again. Next slide. So what's this happening? Well, ultimately, with this Deloitte State of Consumer Tracker from end of July this year, only 26% of international travelers feel safe flying, 33% feel safe in a hotel, and 21% are actively searching for travel deals. Now, this is the average for about 20 or so countries that were evaluated. Effectively, 1 in 5 is planning a trip in the next 3 months, effectively because they do not feel safe traveling. The global traveler confidence has eliminated almost 80% of our former market opportunity. So when we are doing our marketing campaigns, when we are pushing them out there, we're really trying to find those less than 20% of travelers who are considering travel at this time, rather than our most traditional, which was about 80% of our potential market. So it is a tiny market, and we're getting that result as a result. And again, this changes by country. Next slide, please. I'll go through these real quick. But again, Canada and Japan, which I don't have listed here, Canada and Japan are among the lowest in terms of traveler confidence, really meaning that we're much more comfortable staying holed up in our homes than we are traveling for fear of the disease. We see that Germany, about 19% of visitors are looking to find a deal on a vacation, and only 1/4 are willing to get on an airplane. In a couple other markets, US and UK are slightly higher than that, with about 28% of US looking for travel deals right now, and 24% of those in the UK. But effectively, really only 1 in 4 of international travelers, our traditional markets, are really seeking to travel right now, even if travel is open and even if governments are spending millions of dollars to support travel. And finally, when we look at the welcome that they're going to get, only 20% of people in my home province of British Columbia would actually welcome visitors from other provinces. Only 6% say that Americans can come into Canada now, and 9% from the rest of the world, effectively saying that nobody is really welcome. Our borders are closed right now to international travelers. Our borders are closed to American travelers, again, an irrational decision based on the fact that most Canadians do not want travelers and do not want visitors. Restarting the Canadian tourism economy is going to be very, very challenging if these perceptions continue and the welcome is slowed down. When people see license plates from other provinces, their cars are keyed because they believe that they're bringing disease into their province. This is a completely irrational behavior about travel and tourism. And the final slides. So to conclude, tourism's greatest challenge may not necessarily be COVID, but really the loss in trust or confidence from both the visitor and from the destination host. And we've probably all seen this Atlantic article suggesting that the coronavirus may be something that we need to learn to live with. And our governments, in spite of their huge popularity in many cases, need to also consider how to reopen the economy and reopen the tourism economy. We've been decimated in tourism. In Canada, only 1 in 2, a recent survey said only 1 in 2 tourism businesses in Canada have a runway of about 3 months before they will go under. We need these businesses to help us recover our tourism markets in Canada in the years to come, and we can't let them go under. But we also need governments to not necessarily focus on just slick marketing campaigns, but we need government and policy leadership to enable a frictionless return to a viable tourism economy through proper communications. We need governments to create winning conditions for those marketing campaigns that will follow, but we need to make sure that those conditions are there. We also need a return to evidence basis for decisions related to opening borders and reducing the fear for travelers, and visitors over the political decisions that they're taking right now in order to keep up their approval ratings themselves. So that would be my recommendations, how the resumption of travel can only happen. This is the reality on the ground. And this is the reality versus what policies we're seeing, I think, in many countries around the world. Thanks, Damien.
Thanks, Greg. Thank you, everybody. We're going to move into our discussion now. Thank you for that. Greg raised the issue of destinations creating those phasing models or models for showing safe activities. That's a tool we worked on at the part of CRC on the Crisis Resource Center, where destinations can actually build their own tourism-specific guide to phase opening of activities, taking out those scarier, pushing tourism to the scarier column, as Greg suggested. So Greg talked about tourist destinations being managed and the need for us to address that. I talked earlier about the need of looking at yield and how we scale tourism. So we're going to shift now to talk to Dorji from Bhutan, a destination that traditionally has always been a very managed destination that's always focused on lower visitor numbers and protection of the destination through visitor numbers. To talk a bit about how that policy has worked and how we can translate that as a potential roadmap for the future when it comes to managing COVID, I'd like to welcome and hand over to Dorji. Thank you, Dorji.
Thank you very much, Damien. So first of all, I like to echo whatever Greg has said. I think at the global level, I think he has summarized very nicely, and I totally agree with whatever he is saying. Now, coming specifically to my talk here, basically, as Damien has already said, when we now the present scenario because of the COVID is very interesting actually for Bhutan, because now globally, I think because of the COVID, all destinations and countries appears to be looking for a new model or a different model, because so far I think in the majority of the destinations, I think they have been having a tourism model that is totally based on volume or totally based on revenue generation. So therefore now because of COVID, I think they're looking for a different model. And for Bhutan, this is different, because this is something, while other things related to COVID and all similar to it, what Greg has just said, but something very significantly different with Bhutan's case is, as far as the policy is concerned, we are totally different, because for last 50 years, our tourism started in early 70s. In fact, to be very precise, in 1974, with the first group of tourists. They were all from America, about 274. So from the day one, when we started tourism, and in fact, that was also in the early 70s, was the decade when Bhutan actually opened up to the world. I mean, even otherwise. So from the day one, when we are a monarchy, and our fourth king, presently we are under the golden reign of fifth king. So when the fourth king, he was at the helm, he was actually being advised by his peers and other advisors, saying that maybe Bhutan, when we open up tourism, maybe we should open up totally, not limit. But then it is so amazing that that point in time, His Majesty was I mean, he could see the future, and he said, no, I mean, that is not the way that Bhutan should be taking, and we should be very mindful, and we should limit our, I mean, regulate our tourism. So from day one, I think the policy, the tourism policy, which we have been practicing for last 50 years, is popularly labeled as high value, low volume. So now high value, low volume tourism basically highlights this. I mean, what we are looking for today, the whole world is looking for a new model. And basically, while this may not be the only model or the answer, but for us, we feel that maybe the new model that the world is looking for could be this high tourism based on high value, low volume. Now, what this high value, low volume means basically is, the volume is being determined by the carrying capacity of our natural resources, our infrastructure, our services, the culture, nature. So this will be all determined. So therefore, we have been always mindful of the number of the tourists that we take. Of course, now over the years, the number has been rising, but it is always under control. And the other thing is, this policy of high value, low volume tourism is being influenced or guided by our development philosophy. Again, Bhutan stands out in terms of what development philosophy. Our development philosophy is again termed as gross national happiness. Now, what this gross national happiness means, this is something again away from what the mainstream, the global development paradigm. In the rest of the world, I think they follow the GDP-based development model, or gross domestic product, whereas Bhutan's development philosophy is happiness-based development philosophy. Now, basically, what we mean by gross national happiness is this is basically a development philosophy wherein we balance between the material objectives and the non-material. Now, material, of course, is the economic, the revenue generation, the gross domestic product, but the other equally important is the non-material objectives like happiness, the peace, so the spiritual, the nature, the preservations of culture. So these are all very important elements. So therefore, in terms of even the whole development concept, we are following this middle path. Okay, while material objective is important, but at the same time, the other non-material objectives are equally important. So because we believe that at the end of the day, the ultimate objective of any development activities is happiness of the population, happiness of the individual, or happiness of the country. So this gross national happiness have actually influenced, again, the tourism policy of high value, low volume. Now, high value, low volume, as I've already explained, the other element of this high value, low volume is the sustainability of the tourism. So interestingly, so what I'm trying to say is now, in terms of reopening, now in terms of policy, we feel that Bhutan will be much easier for us to reopen, because we need not make any change in our policy, because this is a policy that we have been practicing for last 50 years and something that we can continue to do. In fact, this is going to be even more relevant now because of COVID. But only challenge would be now, how do we tackle this COVID thing? Now, COVID thing is something, again, global, and of course, we will learn from what other countries are doing. And other major challenge when we open up our tourism is, again, Bhutan being a landlocked country, one of the major now obstacle or challenges in opening up would depend on the source market and also the gateways to Bhutan. Now, we only have very limited direct flights connection between the other countries, maybe 2 or 3, but rest, I think it has to route through some other countries like India, Thailand, Bangladesh, Nepal. So these are our gateways because we don't have many direct flights. So this would also determine and highly constrain the time and the ease of our reopening. So these are some of the things that we are challenged with. But otherwise, policy-wise, we are very confident that whatever we have been doing so far is something that we'll continue to do. And in fact, we feel that this is something that maybe the other parts of other destinations would also like to join us in following this policy. So maybe just now I'll stop here. And
thanks. Thank you, Dorje. Dorje, that's really interesting. And I think this is, as we said, scale is such an important part of this equation. And it seems that the policy that Bhutan has long held of managing their tourism in terms of focus on yield and also focus on happiness could be translated into health as well when it comes to finding the right visitors for their destination. And when that really speaks again to experience. So now turning to the private sector level in terms of provision of experience and how we do that within these protocols and retain the quality of that experience. Muna, from your approach working with both accommodation and experiences in Jordan at a very small community level, what's been the experience of COVID and what have you found is working and not working as you move forward? Over to you. You're on mute.
Thank you.
Sorry, one last thing also, people with questions there, please do use the Q&A button that's there below you. Sorry, back to you, Muna.
So we've been able to reopen. We work in community-based tourism in a couple of villages in the north of Jordan. We were able to reopen quite quickly and immediately saw a lot of uptake. There was a lot of interest and thirst from high value, low volume. So we've been very happy with that. That said, the government had issued different policies and protocols on how to maintain safe environments, which I'm sure Raj will also speak to this, but which was very difficult to adapt to. There were no policies on our bike trips or our hiking trips, which were really, already quite safe in the way that they are being run. So we found it a little difficult to implement a lot of these policies. At the same time, in terms of mask wearing, for example, we found the policies to be quite discriminatory as well, that it's more about making sure that the local community and the hosts are the ones that are protecting the guests, but there was nothing about the guests protecting our hosts. And of course, when you go into community-based tourism, you're very much in remote areas, and there's a big responsibility that comes with that. Are you bringing in the virus to these areas where there is more than likely not, the healthcare system is unable to, in the case that there was an outbreak, the healthcare system in these villages is unable to adapt or take care of it. So we found the policies that came out to be very one-sided and not really looking at the general safety of everybody involved. I think another thing that we're starting to see and is a very real concern is, as I think both you and Greg mentioned, recovery is going to take a lot of time. And the perception of risk is definitely more powerful than the actual risk itself. We know that coming from Jordan. We've had to deal with this quite a few times in the past with the perception of safety as in terms of the region that we're in. And we know the significance of it. People's perception really does impact their decision making. So we know this is going to be a long time in recovery. And I think a priority right now is really protecting institutions and looking at small scale companies as well as supply chain. There are members in the supply chain, such as the airlines, for example, that are absolutely necessary to shipping guests around. So it's important to start doing some sort of triage, because governments have very limited funds, and we're starting to see stimulus packages running dry. Or in Jordan, for example, where stimulus packages were really limited or non-existent. So it is important to look at, do some sort of triage and decide who gets what, which institutions are we going to protect, so that in a year or 2 years' time, when we get out of this on the other side, we have these entities existing already and ready to get back into business and bounce back quite quickly. That said, we should also start looking at some incentive packages for rewarding sustainable practices that governments are very much rallying for and speaking about. And there's a lot of promises that have been made, or a lot of statements that have been made about preserving SDGs and building economic systems that are very much in line with the SDGs. And that should now become part of stimulus packages that is being used. I'll stop at that, and then maybe we can discuss it some more once Raj kicks in.
Cool. Yeah, I mean, I think what is interesting, you talked about perception of risk, and obviously there's the risk of travelers, but also the risk of members of the communities that they're visiting when it comes to community tourism, who may not have the medical facilities that those visitors have to fall back on, and the risk that presents as well. It needs to be taken into consideration. And particularly when it comes to community tourism, where those social engagements, those interactions with local people are a core part of that product. Is COVID going to kill that? I think is a question. So Raj, I know your company, and I've been on some of your tours, is very much about that social interaction, particularly some of the festival-based activities that you run. What do you see as the challenges and potential solutions for this?
Thanks a lot, Damien. It's interesting. I think just to kickstart the whole conversation, my talk, Nepal has been a bit slow in the whole thing. Like I said, even COVID is hitting it a bit slow. So we don't know really. I mean, but there's a lot of guesses that are happening, and we're working on some things on this particular front of community engagement. What we are seeing, though, after 3 months of lockdown, after we had only one case in at the point when we started the lockdown, is that at the community level we are seeing a small fight emerging between the local communities and the tourism providers. Because the tourism providers are really hurting, and they would like the tourism back, but the communities really don't want the tourism to come in, because they say if the tourism comes in, the confidence is not there, as Greg said. There's the perceived lack of trust and confidence as well. And traditionally, in a country like Nepal, we don't trust the government anyways, right? So and they don't do much either. So it's unlike Bhutan, where the trust in the government is very high. Here, the trust in the government is not very high, and so there's this difficulty as well. Also, interestingly, one of the first confidence building measures that Nepal did just after the lockdown was we started something called Stranded in Nepal, and actually got 5,000 travelers out. So, which gave tremendous boost to confidence in terms of travelers who said, if I get stuck in the mountain, Nepal will help me out, right? Which is a great confidence booster and became a good story, very nice. But we didn't do much with storytelling on that front, which I'll come to a bit later, which might be an important thing as a takeaway on this front. Then the protocol started after that immediately. So we started making protocols for hotels, started making protocols for tourism offices, for adventure providers, blah, blah, blah. But again, like Greg and you were talking about, it was about scale. So the first protocols that came out for the hotels was for 5-star hotels, but not for lodges down in the mountains, right? And so the lodges said, what will I do with all this disinfectant that you're talking about? When, it doesn't make any sense. So now at this point, in the last month or so, we've been working with some experts on mountain protocols. And there we're getting serious problems as well again, because now at this point in time, we cannot even go into the mountains. The mountain communities don't want us in. Even Nepalese are not allowed in right now in many communities. So to try and go in there and do trainings, for example, on mountain protocols, and then start talking about little activities like treks or rafting, camping trips along the river gets really complicated. So the approach that we are trying to take to try and install this confidence, because that confidence is going to be key in this whole process. I can't talk much about reopening because we haven't reopened at all. So there's not much to say at this point, except our entry procedures are very confusing. On the protocols, what we're thinking about is actually looking at the protection of the community first, and then talking about the protection of the traveler. So the trust in the community has to be much higher, because if you imagine somebody going on an Everest-based camp trek 6 days out on a naturally isolated environment, but gets into a village and develops high altitude sickness and goes into a little coughing fit and gets thrown out of the village in the middle of the night, that is where the disaster really is going to happen. So getting confidence back is going to be really critical in this process. And I think, in a country like Nepal, I also work in Norway, and Norway, the government works really fast, a little over fast. But, in Nepal, it works really slow. So I think the tourism industry has to take the onus here to try and install that confidence. Adventure has got an amazing capacity to work in difficult environments, and also work with protocols, with first aid, wilderness first aid, to start and install all these little mechanisms. So really, that's where Nepal is at this point. A lot of challenges on the ground in terms of preparing the country to come back and installing this confidence. And the only one thing that we've been doing, which is kind of what Damien was doing and I was really jealous about, was actually starting to write stories to inspire people and keep that dream alive. Nepal, thankfully, is a bucket list country for many, many people. So, all we need to do is just keep that dream alive constantly, and gives us a great chance to work on that little safety perception angle as well, if we are smart enough with the stories. And so for me, that is the real takeaway out there, is to, dream now, travel later was probably the only good thing that the WTO came out with until now. And it's one of the strongest concepts that every country should be following, I think, right now.
Thanks, Raj. That's great. So we've burned through an hour pretty quickly. This has been a fascinating discussion. I think there's still lots of room of topics for us to discuss. For those of you that use the PATA CRC, I'm going to be asking the speakers today to join me in creating a blog piece or article to summarize this discussion as well, that we can publish there. A recording of the webinar will also be available on the CRC as well. One question that's come in, Greg, you might be best placed. You've been monitoring these situations, is about, this is all well and good when it comes to experience and travelers wanting these experiences, but part of that decision-making process also involves insurance. What's been the impact on travel insurance around the world, and what are we seeing emerge in terms of a policy of insuring and protecting travelers?
Yeah, insurance is again, confidence of travel is a significant barrier. Insurance is absolutely a significant barrier. It's surprising to me that almost no insurance company has really truly evaluated that level of risk that comes with travel, which is actually quite extremely low if you look at a number of different studies. But no travel insurance company that I'm aware of has come up to the forefront and said, for this price, we will insure your trip and we will help you manage it at the same time. That surprises me. Maybe people are working on that right now. But that is a huge impediment to travel. Only the most intrepid of travelers are going to travel without that level of assurance from insurance.
interesting. So as we wrap up on the top of the hour, I'm going to ask each of our speakers just to give us in one sentence what they think is the future of travel, what we're going to see in the next year, what really we're going to start to see emerging in a genuinely restarted travel industry. I think to sum up everything we've discussed today, what we've seen is that the challenges are still out there. Just opening borders and establishing health protocols is not enough. As Greg has stressed, there is a lack of confidence out there. People need to be unscared of travel. It needs to be perceived as less of a high-risk industry. We need those assumptions about health and hygiene that are there, but they also need that confidence brought back. And that means creating appeal for travel. And that means showing them appealing experiences. And there's going to be less people willing to travel, but those people will be committed to those experiences. It will be a different type of traveler. As Georgie has said, and as Bhutan have proven, they can find a small, dedicated market for their country that has supported their destination. And it's finding those people who are not just interested in happiness, but health as well, and are looking for genuinely open, naturally, socially distanced experiences around the world. That will be the first wave of travelers. And we need to find a way to support those small businesses offering experiences, people like Muna, people like Raj, that are dealing with smaller client bases and offering them genuine, authentic experiences. And they need to find locally appropriate solutions to do that in a safe way that appeals to those new markets. So to wrap up, I'm going to ask each one of you to give your little mini forecast for how you think travel is going to restart. And Greg, do you want to kick that off?
I'm really inspired by both Muna and Raj and frankly Dorji about this community-based approach and the small numbers of travelers. But now I'm more worried about the receptiveness of visitors to their communities. I get that small remote communities are particularly not equipped to deal with a COVID outbreak. So confidence within those communities, finding ways to instill that sense of confidence within those communities, I think will be significant to help us kickstart and restart tourism going forward.
Great. Georgie?
Yes, I just like to say that while the health, the protocols, related to quarantine and all this COVID is not so, good as a marketing tool, but at the same time, I think going forward in future, the future of the tourism will be very much dependent on the wellness and well-being. How safe tourists would feel in that particular destination. So at the same time, maybe while Damon has really talked about it, but I feel that is also equally important. And as far as Bhutan is concerned, I think that is something that has been already taken care
It's 3 o'clock.
In terms of the safety, in terms of the space, in terms of the all. Hello.
Great. Muna?
Yeah, I think that as runways run dry, we're going to be heading into seeing a very new playfield of tourism companies. And I think we'll start seeing the limber companies survive through this. And then on the other side, you'll have the big financially backed companies that are surviving through this. And I think it calls for the sector to really stand up and hold everybody responsible to what kind of future do we want. As we see ourselves now, very quickly going into the old ways of how travel used to be and really fighting to bring it back to that. I think we're going to soon face the reality where we actually need to rethink it.
And lastly, Raj.
Yeah, the way I see it, looking from a country like Nepal, I think it's almost like we're restarting tourism. We're going to concentrate a little bit on around us for the time being, and the genuine, initially we had thought that taking people remote into isolated places will be good, but we also realized that they will not be able to handle if there's an outbreak. So we have to actually start again from small and building it up. But experiences are very important. I completely echo that. And I think there'll be more and more travelers that are looking at understanding human nature at this point. There are more cooks now than ever before, so they want to learn how to cook. They want to learn about herbs. They want to learn about different things. And that connection, the connection is coming from that angle. It might not be a physical touch connection, but the community touch is very important. So I think that's what we're going to see. The first wave is definitely going to be the we like to call them cowboys here in Nepal. So cowboy travelers who don't care about health, they don't care about institutions, they don't care about visa rules, they don't care about anything. They are the first ones to come in. And they will probably create the stories that will drive the other people who want to be like them. And I think that is, so basically adventure is where it's going to start, is where I predict it. So.
Thank you, Raj. So to wrap up, indeed, as you can see, we all concur that the road to recovery is still long, it's still challenging, but it's certainly taking us to a different place. People talk about the light at the end of the tunnel for travel and tourism, but what we must never forget is that the thing about tunnels is you don't come out in the same place that you went in. There is a new world of travel that's going to emerge, and that is what we're going to see restarting. And we'd invite you to visit the PATA CRC, the Crisis Resource Center that we've created, where you'll find a recording of this webinar. I will work with the speakers today to develop a blog and article piece to follow up on that as well. And also there are contacts there. If you have any follow-on questions from this session, you can send through the contact address there. Thank you to each of our speakers, to Greg, to Dorji, to Muna, to Raj, and to PATA for setting up this event today. I hope this was useful and enjoyable for you all, and we look forward to joining you at another PATA webinar in the future. Thank you very much.
Thank you.
Thank you.